Kindbody is changing the face of women's health and family building forever. What Kindbody is doing is infusing hospitality and technology to deliver a patient-first, patient-centered care and experience that has never before existed.
One of the things that uniquely separates Kindbody is the fact that we're able to truly provide comprehensive care. What we do in our clinics every day is really provide an end-to-end solution for women. We take care of their entire array of gynecologic needs, from STD screening and pap smears and contraception to the entire full spectrum of fertility care. The fact that we're able to provide that all under the same roof, I think that really provides an excellent patient experience and really ends the fragmentation that currently exists in women's health care.
Kindbody's mission is to increase accessibility for all. The challenge with fertility care is it's cost prohibitive. Historically, fertility care has been for the wealthy 1%, and we're on a mission to change that. Only three things matter in healthcare: patient experience, patient outcome, and cost. And in order to really effectuate change in those three areas, you must be in the provision of care.
We have control over every aspect of our clinic, so we can make sure that we're providing the absolute highest service to the patients and the best quality. All of our labs have the very latest technologies. All of our physicians have done fellowships in reproductive endocrinology. All of our embryologists are very experienced. All of that skill allows us to operate at the very highest level and provide the highest level of care.
Price transparency is core to our mission at Kindbody, and it's really what distinguishes us from others in the market. We have one fee schedule of bundled case rates, which are bundled rates for the entire service.
We are the only fertility benefit manager that allows employers to buy services directly from doctors. What this means to the employers is that the savings are pretty material when you eliminate the middleman. We want to empower patients. We want to provide transparency to employers, and you do that by investing in technology. This technology allows us to bring down cost, making fertility care much more accessible to many more people. Because we're in the business of delivering care, we can control for our own cost. And so our savings are 30% in most instances against the fertility benefit solution provider today. Our patient portal, our EMR, and all of our billing and collections is all integrated. It's all under one tech platform. So when the patient comes through with treatment, she can see her own ultrasound scans because the medical equipment that's reading her follicular development feeds right into the EMR. This goes back to our mission of empowering the patient. We believe the patient should have just as much knowledge into their fertility journey so they see their own ultrasound scan, their own follicle development just as the doctor sees it.
So we're collecting lots and lots of data every day. We can follow fertilization rates and embryo development and pregnancy rates, and so we have all of that information at our fingertips constantly.
In addition to our own Kindbody brick and mortar clinics, we have partner locations around the country.
We've also developed a network of global partner clinics. They're like-minded, they're vetted, they're high quality. Our global fertility benefit solution is quite substantive. Not only do we offer multilingual care navigation, we've also retained experts in Europe and Asia to assist with understanding the international regulatory landscape and guide them to the appropriate care.
All of the clinics in our centers of excellence are chosen because we know that they have very good success rates. We also know that they follow the guidelines of our professional organization and adhere to the highest standards. We also look for clinics that have female providers as well as the male providers because we know a lot of patients would like to see a female provider, so that's important to include them.
We spent a great deal of time incubating this amazing design aesthetic that is warm and welcoming. Frankly, it does not look anything like a clinic that I have ever been in. They are beautiful, and every one of them follows the same program, which means they are clinics that have IVF labs in them to make the experience seamless and convenient for the patient. We are opening all across the country.
So when you look at Kindbody, not just its warm, welcoming locations, but our clinicians, more than 80% of them are women. They're not exclusively white women. When you poll patients, they want a clinician, a doctor that looks like them. We really want to fight against social injustice in this country. And in order to really change that, you have to make cost more affordable. That's what really motivates the team here at Kindbody, is once you're in the provision of care, not only can you be generous, you can create change, you can control for cost. Every patient deserves a way to build their family.